Let's film. Here's something that most people haven't considered. The research on microplastics and chemicals in sanitary pads and tampons, products that millions of women use every single month, it might be one of the most important clues as to what's going on when we use plastic disposable nappies on our babies. When you look at the products side by side, the parallels are striking. But the research on sanitary pad use, the research on that is way ahead of the research on nappies. So what can we take from sanitary pads and the effect that they have on female health? What can we take away from that for our babies? Let's talk about it. Disposable sanitary pads and disposable nappies are at the core the same kind of product. They're both made up of layers of plastic polymers, polypropylene, polyethylene and super absorbent polymers wrapped in synthetic materials. Both sit direct contact on some of the most sensitive absorbent tissue on the human body. They're both worn for extended repeated periods across years of people's lives. For babies, for the first 3 years of life, and for women from their 12 until 40, every month they're wearing these things for a week at a time. Sanitary pads get used for 30 years for a woman, around 11,000 products in a lifetime. And a baby wears a nappy for around 2 to 3 years of their life, using around 5 to 7,000 nappies in total. The difference is that the research on period products reveals a lot of concerning things, and a lot of these things have not been applied to babies who wear this basically the same thing every single day. Here's what we do know. 2025, there was a safety assessment in 29 commercial sanitary pads published in a peer-reviewed journal, and that found that every single pad shed polypropylene microplastics, which with ranges counting from 6 to 115 particles per pad. The same study detected volatile organic compounds including benzene, toluene and formaldehyde, and some of these are known or suspected carcinogens or endocrine disruptors. When we look at tampons in 2021 from Middlesex University, they used a device that simulated vaginal conditions, found that synthetic tampon fibres fragmented during use, and released estimated billions of nanoparticles per tampon, which would come into direct contact with the vaginal wall. And what researchers found is that exposure through vaginal or vulval tissue has absorption rates of at least 10 times that through any other area on the skin on the body. Vaginal mucosa is rich in blood vessels and lymphatic tissue. It absorbs substances directly into the bloodstream, bypassing the liver's first pass filtration, which would otherwise metabolize into many other compounds. Unlike the skin on your arm or leg, it holds chemicals in close contact rather than shedding them. And that's why researchers considered this route is particularly concerning. The area that a baby is being exposed to in their nappies and a woman in their sanitary pads is extremely sensitive. Now, what does this mean for babies and nappies? The nappy area in babies is the same sort of skin. It's not regular skin like your arms. Research published in PMC confirmed that infant epidural, so the skin, is 20 to 30% thinner than an adult skin. Babies also have a much larger surface area to body weight ratio, up to 5 times that of an adult, meaning that the greater proportion of their body is exposed relative to their size. In 2024, a review in Science Direct on infant chemical exposure from diapers or nappies notes that disposable nappies does come into direct contact with reproductive organs, tissue like that of the vaginal mucosa, and has significant higher permeability than any other skin on the body. When babies have nappy rash, which is very common, that skin barrier breaks down even further. Researchers in PubMed on nappy safety evaluation found that nappy rash adversely impacts the barrier properties of skin itself, meaning that potential absorption of chemicals in this nappy rash area is higher. What this means is that a baby who has a nappy rash, who's wearing a disposable nappy that is shedding microplastics and emits volatile organic compounds, is exposed to the most permeable, sensitive skin in their body, covering their reproductive organs, and those substances are repeatedly exposed for 2+ years of their lives. There are no long-term studies that have tracked what this means for your child's health outcomes. Let's be clear about what's established and what's inferred. We do know that disposable sanitary pads shed microplastics and contain endocrine-disrupting chemicals. We know that vulva and vaginal tissues absorb chemicals at a far higher rate than any other area on your skin. We know that baby skin is very easily irritated, highly permeable and sensitive. And we know that infant detoxification systems are immature, especially compared to adults, making them much more vulnerable for chemical exposure than adults are. What we don't have is a study that proves or tracks the risk of disposable nappies and links them to health outcomes yet. That research hasn't been done. But sanitary pad evidence and what we do know about the infant skin biology does give us a really strong and serious reason to ask this question: should we be concerned about disposable nappies on our children's health? And I think what we should do until research hopefully catches up, and I think that we should probably push for research on this, what we should be doing is acting on precaution and prevention as much as we can. So what can we do as parents? Well, manufacturers of both period products and nappies are not required to disclose their ingredients at all. Regulation is very, very lax according to what we're putting on our most sensitive areas, partly because these products are classed as hygiene products rather than medical devices. And the people that are using these products, i.e. women and babies, are rarely the priority for safety product research. So if you want to reduce your baby's exposure to chemicals and microplastics that are found in disposable nappies, what we can do are choose reusable nappies with natural fibres like cotton, bamboo and hemp, and trying to avoid plastic skin contact as much as we can. If you are using disposables, make sure to change them promptly. Don't leave baby in a nappy for a long period of time. The warm, moist environment gives off more potential there for chemical off-gassing and particle contact. Treat nappy rash quickly, so we don't want them to be sitting in urine and upsetting the skin barrier. If you use disposable sanitary pads yourself, the same logic applies. Use organic cotton, plastic-free period products, use reusable products as well, reduce your exposure through the same mechanism. Again, we're at a really early stage of understanding the long-term impacts of these products. There's not enough research, we're not shouting about it loudly enough. But the evidence is accumulating, if not in different areas, but we can infer from that. The structural similarities in sanitary pads and nappies mean that what's being uncovered in one area, i.e. sanitary pads, is almost certainly going to have similar, if not the same implications for the other. So the question isn't whether we should panic right now, it's whether we should be trusting these companies who are making these products with or without regulators overseeing them. Have we asked them the right questions? Are they asking themselves the right questions? And should we as parents be putting pressure on those regulators and those companies? And I think personally, yes, we should be putting pressure on. Anyway, if you like this video, please do hit like and subscribe. I will list everything in the description, all of my studies. If you like this video, I'm making plenty more about research-based academic papers, trying to give us helpful, relatable parenting advice so that we can be better parents together. That's the goal. If you like this video, please do hit subscribe and like, and I'll see you for another one. See you later.